Welcome to Celebrating Act Two. Celebrating Act Two is the user manual for the second half of your life.
Welcome back to Celebrating Act Two. I'm here with my partner, John Coleman, and our special guest, as always, Dr. Liz Lister.
Dr. Liz, good to see you again. I noticed that among your many credits, among all those initials at the end of your name, after the MD, by the way, is a PE, public, it's a PH. You're a public health expert.
MPH. Yes.
MPH. You are a
MPH.
Masters of Public Health. You are a public health expert, and that seems to me to really us require us to talk about the public health today and COVID-19. What's going on? We know a lot. We don't know everything. We're learning more every week.
Yeah.
But one of the things we know is that different parts of the population are, I won't say more vulnerable. Everybody over 50, 60 is vulnerable in generality, but parts of the population seem to be affected more than other parts, specifically African Americans and Latinos more than whites. What is it? The rate of infection is higher with those groups?
Okay. Yes. And also the rate of deaths
Oh,
in those groups. So there's definitely racial disparities. And it's definitely, if we approach it as a public health issue, we can try to move away from the politics of these racial disparities. So we can
which
just
is
look at
always a good
data.
idea. Yeah,
Yes,
always a good idea.
especially it's always a good idea, especially when we want to actually make change and help people and help our society be a better place and be a stronger society together.
Sure. And COVID-19 is not a racial issue. It's a medical issue. It's a pandemic, pan meaning
Right.
everywhere. So
Everywhere.
it affects everybody. It's an equal opportunity killer.
Except I think that what Dr. Liz is referring to is that it has a higher rate of infection among certain groups. And how about we explore a little bit reasons why?
Exactly. So for a little bit of data, just for people to have a sense of it. So when people are really focusing on this, what they're talking about is, for example, African Americans are about 13% of the population in total in the US, but they're overrepresented with deaths. So
Wow.
unfortunately, 23% of people who have died from COVID-19 are African American. Now,
Wow.
this is an average across the whole country. In some areas, it's better, but in 4 states in the country, it's worse than that. So that's about double the incidence that you would expect, but in some parts of the country, it's 3 times. So it's really disproportionate. Same with Latinos across the board. The percentage of people who contract the virus who die from the disease, that percentage is more than the percentage of the population, whereas across the board among whites, it's less than the percentage of the population. So that's
So
what people are talking about when they're referring to these disparities.
Well, bits and pieces of conversation we've had over periods of time. Uh, I just want to dispel that you've indicated this is not a DNA issue primarily.
Correct.
What is the public health
Correct.
implications of this that have nothing to do with DNA?
Right, exactly. No, it's not thought to have anything to do with DNA in particular. It has more to do with access to healthcare and also socioeconomic differences among these populations. So, for example, a lot of times these either depends what you want to say, racial background or ethnicity. I prefer the ethnicity terminology, although we use race a lot already in the reporting. So, for example, a lot of these populations are overrepresented in lower paying lines of work, a lot of which are considered essential workers. All right. So, a lot of maintenance, a lot of um, people who are, for example, I've been reading about the important role of people who are the cleaners. people who are the hospital maintenance workers. So they tend to be overrepresented in these types of population groups. Okay, and so they're going to be more exposed. They're also playing a really important role in uh, helping care for patients who are sick and who are hospitalized with COVID-19.
Okay, so
That's
what you're
one
saying is
example.
that they are more likely to be exposed and to have lower
Yes.
levels of health care. So thus, they're exposed, they may catch it, and at some point, we've been talking about that they tend because they're, let's say, they're socioeconomic, they live in more dense situations with other people,
Right.
Yeah,
and so their
exactly.
transmission once they get home is another factor that doesn't weigh in their favor.
Exactly, exactly. That's exactly right. So crowded housing and simply a lower chance of being able, for example, being able to afford to stay home from work. If they're able to go out to work, they have to go out to work in order to put food on the table and continue their livelihood. And then, as you said, they come home. They're in more crowded environments. So we've been talking about physical distancing, or I don't like the term social distancing. We could connect socially, but we have to physically distance. And that's hard to do when you live in multi-generational housing environment or in a crowded part of a city, for example, as opposed to another area where houses people are in houses and more spread out, as opposed to a high-rise apartment building where people are in very close quarters and they literally just cannot do that most simple important step of staying physically distant from other people.
Right. You know,
Yeah.
it's an interesting dichotomy. Your background is medical on one side, that's when you treat patients individually, and you're a public health officer, masters of public health, and that's looking at the society as a large, at the public's health.
Yeah.
Um, and is there methods, or is anybody trying to solve this problem, because it affects all of us? It's a pandemic. We
Yes.
can't afford to have anybody in the United States get ill, because it'll
Right.
affect the rest of us.
Right. Exactly. Exactly. And we need everybody working. Everyone who wants to and is able to work, we want to have them working. We want to have the economy in good shape.
You
Everybody,
bet.
we have the same end goals, no matter what people's politics are. I think that we really share. I think the vast majority of Americans share these common end goals. We want a just society. We want people to be healthy, and we want the economy to be strong.
Of
We
course.
want
Of
we want
course.
all we all want all of that.
So I think the message that you're sharing with us today, and I thank you for that, and I think our audience is going to be thankful, is that basically it's the higher incidence in African American populations in general, or Latino, is the fact that they may have lower socioeconomic uh, abilities to get health care, maybe to own a car and
Yeah.
go to work, they have to take public transportation. They are the essential workers that are helping the rest of us, whether it be restocking shelves or helping sick people. So it's not a DNA thing at all. This is
Not at
pure.
all, not at all. I'm glad you mentioned that because that was actually one of the amazing pieces of information that I came across, and how important it is and how much we have to look at this with the data going forward is, for example, with testing. A lot of the testing sites, including my area up here in Northern California, were drive-through testing. But there was a municipality, it was somewhere in the South, it was either Texas or Louisiana area that I was reading about, that they quickly realized that they were not finding the cases because people weren't coming to those testing sites because they didn't have cars. These were people who lived in a city area, used public transportation, and just because of that one factor, they were not getting tested. So of course they were able to shift their approach and do better testing. And we're getting better with the testing, and we have to continue improving with the data collecting. There's a
Yes.
lot, unfortunately, it's a big uh, very big discrepancies around the country of how the data is collected. Even the categories of people might be different. Okay, so for example, I was mentioning that when we were chatting offline about one state, West Virginia, which I spent my childhood in West Virginia. They report black, white, and other. That's it. So we are not going to even be able to look back unless we can develop a uniformity across the country of collecting the data. We won't even be able to look backwards and be able to analyze what's happening.
Yeah. Well,
Yeah,
the COVID-19 pandemic is still brand new for us. Um,
correct.
and we are learning stuff every week, every month. So hopefully, as we learn, we can get better data and then make better
Yes,
decisions as a
yes.
society, as a public health issue.
Yes. And for our audience, especially for celebrating Act Two, the the virus is equal opportunity. The virus is causing deaths at the same age distributions in no matter what the race or ethnicity is. Okay, so it's still the older people that are more at risk of getting significantly sick and unfortunately dying from the COVID-19 illness. So it behooves us all to um, help figure out where the racial disparities are and
And
make
solve them.
things more, yeah, and solve them to solve the access to good preventive health as well as healthcare measures to help us move through this pandemic so that we can all move forward together as a society.
Yeah. Good advice, great information. And Dr. Liz, I know you'll stay on top of it. We can always go to your website, which is
www.drlizmd.com, drlizmd.com.
good.
Well, not only thank
Dr.
you that
Liz, it's
I know that John and I, and I'm cutting John off here a little bit, but we value you so much for your the information you're giving us to live healthier lives as we are playing out our Act Two. Uh, but this is another side of you, which is your public health
right.
background, and we appreciate you sharing some things that people just may not understand, but to better understand, as you say, that the virus is equal opportunity, and we need to take care of each other.
For more on Celebrating Act Two, visit our webpage, follow us on Facebook, subscribe to us on YouTube, and tell your friends. Celebrating Act Two is the user manual for the second half of your life.